This patient was referred to me for endodontic retreatment of tooth number 4. This root canal was done by a dentist a few years back. Teeth number 3, 4, and 5. All 3 of them were done by the same dentist a few years back, and patient had started to have pain to biting and chewing on this tooth. So I found the tooth to be percussion and palpation tender. Probings were 2 to 3 millimeters, and as you can see, based on the radiograph, you can see that the tooth had a root canal previously. So I went over options with the patient, and patient decided that he wanted to go ahead with the endodontic retreatment, and that's what we did today. Crown. And this is it. So went through the PFM crown and removed the amalgam buildup, and noted the gutta percha. Looks like the dentist didn't use a rubber dam, so the gutta percha was all black, contaminated. That's a sign of contamination of the gutta percha. When the nice pink color of the gutta percha turns black, that means contamination. Removed all that contaminated gutta percha, and take a look here. Look at this. There is a periapical, not a periapical, but there is a radiolucency. It's not a periapical, but there's a radiolucency. And look, I got a lateral right into this lucency right there. And look at all of this anatomy. Just count the laterals. You can't even count the laterals. How many laterals? That's a big one right into the lesion there. And there was some blockages that I was able to bypass and overcome. So both canals, I was able to get them patent. But I mean, look at that. Look at all of these laterals here. And that big one, of course, right into that lesion there. And this is another angulation. Again, you can see that big lateral right there, and all of these smaller laterals right there. Look at that. Look at all of that. And all of that. So this is what we call three-dimensional instrumentation, irrigation, and obturation, where we're able to clean all these canals, all these lateral canals, clean them three-dimensionally using full-strength sodium hypochlorite, getting rid of all that necrotic tissue perhaps that had remained there, and then using ultrasonic and sonic activation of the sodium hypochlorite to push that hypo into these areas and kill all the microorganisms, and then three-dimensionally obturate.